Hello. Today I'm going to demonstrate a head-to-toe newborn examination. I will walk you through each step, including vital signs, assessment of body systems, and reflexes. Let's begin. First, I ensure the room is warm, my hands are clean, the baby is undressed except for a diaper, and the baby is calm. I start by observing the baby's general appearance, color, posture, spontaneous movements, and breathing patterns. Now I will take the vital signs. For respirations, I observe the baby's chest for rate, rhythm, and effort. To check the baby's heart rate, I palpate the brachial pulse or auscultate the chest with a stethoscope. For taking the baby's temperature, I measure it at the axillary site using a digital thermometer and record it. For weight, I weigh the baby using a calibrated scale. I ensure the baby is naked for an accurate reading and document it. Now, I will examine the head and the face. For the skull, I palpate the fontanelles, both anterior and posterior, and assess the sutures for size and spacing. To evaluate the face, I check symmetry of facial features and note any unusual findings. I observe eye movements, symmetry, and the pupil response to light, and note the red reflex. For the ears, I assess placement, size, and shape. I check the nostrils for patency. For the mouth, I gently open it, inspecting the palate, gums, and tongue. Here, I elicit the sucking reflex by gently sticking a gloved finger into the mouth. Next, I assess the neck and the clavicles. I gently move the neck to assess range of motion. I palpate the clavicles to ensure there is no fracture, and I also assess for lymph nodes. To examine the chest and heart, I inspect for shape and symmetry. I observe respiratory efforts again and auscultate the heart at the 4 valve areas to assess rhythm, rate, and murmurs. Then I inspect the abdomen for shape, movement, and umbilical cord status. I palpate gently and note the umbilical stump. Next, I examine the genitalia and anus. I examine the genitalia for normal appearance and symmetry. For males, I check the size and the length of the penis. I also check to see if the testes have descended. For females, I assess the labial folds, and then I confirm that the anus is patent. We will be moving on to the extremities. I examine the arms and legs for symmetry, movement, and muscle tone. I palpate joints and assess for any deformities. I check the hands and feet for number of digits. Now I will check the hips for developmental dysplasia. I gently flex the baby's hips and knees to 90 degrees. Using the Bartlett remover, I adduct the hips with mild posterior pressure to see if the hip can be dislocated. Then, with the Ortolani maneuver, I abduct the hips while flexing the femoral heads anteriorly to check if a dislocated hip can be reduced. I repeat both sides and note any clicks or instability. Next, I will elicit the primary newborn reflexes. For the Mora reflex, I gently lift the baby's arms and allow them to fall slightly to see if the arms and legs extend and then flex. For the palmar grasp, I place my finger in the baby's palm and note the grasp. For the plantar grasp, I place my finger at the base of the toes to observe curling of the toes. For the rooting reflex, I stroke the baby's cheek and observe turning of the head toward the stimulus. As previously done during mouth assessment, I observe the sucking reflex when the lips are stimulated. For the stepping reflex, I hold the baby upright with feet touching a flat surface to observe stepping movements. Next, I inspect the spine for alignment and skin integrity. I palpate along the vertebrae for any abnormalities. I once again examine the skin for color, turgor, birthmarks, rashes, and any lesions. For the final steps, I ensure that the baby is warm and comfortable, redress with a clean diaper, and document all findings clearly. I discuss any observations with the caregiver. That completes the full newborn assessment, including vital signs, physical examination, and reflexes.